has a high fertility rate and they want to sell eggs to Mulago, do you buy?
Chair, we don't. There is if you are going to donate anything, it is for free, and that is even the arrangement we are planning as an entity, that you come with your sister or your relative to donate for you, and then for us is basically to assist you.
Doctor, have you ever heard there is some clinic that complaint was on social media, that they buy women go there and sell? I don't know whether you've ever heard about it, that women go and sell eggs. Mm-hmm. So equally people felt that they can be safer in your hands. If for you can buy, but if that is not, because these things happen out there, and you need to advise the public on how they should handle some of these cases. Women have been people have been taken advantage of. Somebody goes, they tell you, oh, the process that you go through, then the egg goes for, they said 800 after you having gone through that. So people are doing it out there. So as a doctor, advise on how is it safe for whoever does it, because people say they can sell as many as they can as long as they have. Yeah, it happens.
Now the process of is actually a long process. Even who is going to donate, they have to prepare you. They give you some medication, and then they watch over you, and then they take you to theater to harvest those eggs. Sometimes it is not that safe, because the medicine they can give you can make you actually react. That's why legally the person who is going to donate eggs should be able to consent. And for us as an entity, we are not going that level that come and donate your eggs and you pay you money. There is no money. First of all, you don't have money to buy eggs. You don't have money.
But excuse me,
we cannot provide that. Legally, there is actually an act, I think, already not yet signed, I'm not sure.
Yes,
donation of organs.
Reproductive health and something.
That act, I think I was coming to that. That needs the policy and the legal framework.
Yes.
And it has to be, I think, let's agree for the fact that the donation of the organs, wherever it happens, but it has to be done in a framework that is medically recognized and observed. I wanted to know, is there any I know we worked on that bill, I think so, but do you have it in place that can help? Because it's true that we need people are willing to help, and they don't know what to do, where to begin from.
It's not yet approved.
It is still in Parliament. Maybe, I'm not sure. Maybe it is not yet.
Check, what is Saropendi's thing? At Honorable Saropendi's bill, what is it about? So, Opendi is not ascended.
But in any case, if it was ascended to, they would be the right people who would have received even the policy.
So, Honorable Sumani, Sarah was not that IV. Yeah. Women Specialized and Neonatal Hospital. Who should go there? In brief, for somebody, for someone who wants to understand, who should go to Mulago?
Thank you so much.
Don't know when we should go to Mulago. Some people think it's only for women. And now the other area of neonates, there are many of those that are produced from somewhere else, then transferred. Because, this area still has so many challenges. And I would like you to update the country. What is the rate? Is it increasing? Do we have an increasing rate of giving birth to neonates? Is it increasing or it is reducing? Number two, when I looked at your staffing in this unit, really the staffing is very alarming. I'm privy. I have my second born was a neonate at 1 kg. But you know what it means to bring out such a child. And for now he's in P4. So when somebody speaks about neonates, for some of us who have gone through it, we know what it means. And these 1 to 6 nurses, really, this is too much. If there is a sector that should be, where funds should be allocated in terms of wage, The neonatal unit should be staffed 100%. When it comes to all the care, you don't know what it means to lose a baby in the neonatal unit. Some people come having taken so many years to get pregnant. Somebody gets like a baby, whether 500 grams, very tiny as it is. But somebody sees, it is valuable to whoever owns it. So it is a sector, honorable colleagues, that we should pick interest in. The neonates is a very unique sector. And if I want to know from you how much money has been allocated to Mulago in regard to wage, how many staff do you intend to recruit? But honorable colleagues, we should push for 100%. All sectors are very important, but the neonatal is a bit, it's unique in nature. That sector should be taken care of. You spoke about the waiver. For me, there is something I don't agree with. Yes, you can waive for those who we think cannot afford. But medical care is expensive. Whoever takes a step to come to Mulago Specialized, most of them were here with Chirudu, and they were like 80% of Ugandans cannot afford some of these services. How do we look forward to unanimously serve Ugandans when it comes to your services? Those things of waiving, it's at the discretion of your team to waive. We know there are those who can afford, but how can we standardize? Because, corruption, these other things, you may not get the statistics the way you may want it. How can we ensure that we get services to as a low cost as we can? Because waiving is okay, but it's discretional. It is discretional, and I don't know whether immediately I come, you can easily know that I can't afford and I get a timely service. So we need to look into the waiving, because to some extent it's being misused by whoever is given the authority to. Then we talked about the water bills. The water bills are a challenge in most of the hospitals. What plans do you have for in line of water harvesting? All those other, because water bills, and at times the wastage by the patients themselves. How do we regulate the use of water? Because these bills, as long as we don't have internal mechanisms to reduce on the waste, these bills will increase. The other thing we cannot afford to live as a country is power shortages in Mulago. In these hospitals, we should have 100% supply of power. We have excesses. You pay for dimmed energy. For all these state houses, no power has never gone off in a state house. So if you can, in the president's residence, power should not go off. And when it comes to Mulago, it is optional. That is pure and unacceptable. And yes, you can run a generator, but that cost comes back to me as a patient, because that is part of the operational costs of Mulago. We produce power, we sell it outside this country. Honorable colleagues, we should have it as a must for all the hospitals to have electricity full time, except when it's a technical breakdown. But Mulago power goes off, on and off. How? In a country that generates its own power, when you even pay for dimmed energy, you consume what, you produce what you can't, generate what you can't consume. And then we allow Mulago. Do you know how many people have died because of that? Power off, immediately people die. The time the generator goes on, I'm telling you, for me, I was in the neonatal, but I saw what happens there. When, how do you call it, those incubators, when an incubator goes off, the time, at times for you might be lucky that it's somehow automatic. But in Masaka Regional Referral Hospital, it goes off for 5 minutes. I'm telling you, scuffle. We lose lives, people die. So we can afford anything, but switching off power, those power shortages and breakdown in hospitals, we have the capacity to minimize that. And I think one of the resolutions we should make is this: if State House can have supply of electricity throughout, then we cannot see hospitals. So yes, honorable colleagues, if there is anything, yes, Honorable Angura.
Thank you very much, Madam Chair. State House. No, we need power everywhere, but don't make reference to State House. It is not the only privileged one. We want to make sure that the health centers and facilities are privileged. Madam Chair and colleagues, and for the benefit of our guests this morning, my name is Frederick Angura, and I happened to have delayed to come, Madam Chair. As I told you, I was on my way. And where was I? I was actually at the Specialized Women Hospital. I want to thank this team that now my people from my constituency have embraced the good services of the Specialized Hospital. They are there, and I've been visiting one again. The only problem is, of course, when it comes to the good service that you offer, as doctor has said, that you first offer the service, then you now discuss about the bills. So people are happy. When the service has been given, they start now looking up in the ceiling and calling us. And that was one of the calls I responded to go and see. And then when I get back, you'll know what to do. But I want to appreciate the good work that is already there, the anxiety that is around the whole country. But you've never answered one sensitive question. We have kept asking here, and we thought one day you would be able to consider. This is the Mulago Women Specialized Hospital, but you're also talking a lot about men. Out there, men are still complaining. Why don't they add this name, stroke men? Because the specialized services, now you're attending towards all of us, but just that word, women only, it is continuing to disturb. So since the specialized services are also tended towards us, the men, just put stroke men.
Move with your wife, because
Yes.
we men, it is the same. A woman and men, we are all the same.
My proposal is Mulago specialized women and men hospital, and then that one, we need the specialized services we are talking about.
For you, they will open one for you. That one is for women.
Okay, it is good.
When,
Doctor and the team
Hey,
have had.
if your wife gets value, these children belong to you. So you are part of us. Hey.
No, you see, there's a bit of complaint that is out there when it comes to fertility.
Let them go to
The
Mulago
concern
men.
of fertility at the times is being blamed on the women. And maybe the reverse is true.
Yeah, we only have
Eh?
one day in a year, women's
The reverse
Day.
is true.
So what about
So, Madam Chair, since order is coming from different
You are protected,
directions,
sir. The boy child is protected.
allow me rest my case there. But I wanted to find out, maybe for the benefit of the viewers and listeners out there. You've talked of 11 couples that have successfully been managed by you in terms of fertility challenges. But you say the provision or the exercise is very costly. You've not told us what does it take. Let people know. There may be many who are quiet out there, but if they also hear that it is within reach, they can come and take a gamble and request for a waiver when the results have been seen. What is the cost? Thank you.
Yes, Honorable Susan.
Thank you very much, Chair. Chair, I have a few questions. My first question is relating to the process of donating over. Our fourth estate would like to know, so that as they report correctly what the doctor has said about donating over. They did not get it well. However, Doctor, you put out some challenges that you're facing, and those that need immediate action. My only question is, are they in your budget? We are in the budgeting season. We cannot initiate this in the budget. If you put it there and call it, you have your terms, you like calling them unfunded priorities and what, and at least let it appear in the budget so that we can see where we can touch and where we can go. Because if you come here and lament to us as an accountability committee, we don't, first of all, appropriate money from here. It is in the parliament. So now, when we get to know this, is it there in the budget so that we can follow up and push? We don't initiate budgeting here. It is you to put it there, and then you get what you want. We see how to help you from there. But now if you come here and just tell us, we don't have this, we don't have this, we don't have this. Okay, we have known you don't have. So what? What are we going to do? That is my question to you.
Yes, Honorable Taringa. Isaac, you want to introduce yourself?
Yeah, I'm introducing myself. I'm called Isaac Modoi. I represent the people of Lutseshen Kududa. How about a colleague raised a very pertinent, in my view, pertinent question. Why don't we call it specialized services and stop at that?
No, you can't.
And classifying it.
No, you can't amend. This is not allowed for women as long as we are still here. There is no amendment on that. They can open up another one for men, but that is non-negotiable. It's tojikwatako. So that one is entrenched. If you want another one, open up.
Reproductive services and newborn. Anyone who is planning to conceive, for example, can use the facility. Anyone who has a pregnancy and has challenges of carrying that pregnancy up to term should actually utilize the facility. Anyone who has had a challenge during childbirth, has lost any baby, should be able to utilize that facility. Anyone who has had challenges of conceiving, okay, you have now facilities which we have specialists and facilities which can assist the person of that kind. Now, there are those who are seeking to know about their health, well-being, related with women, screening for cancer. We have the services there. But even those who have been detected with cancer can go and seek services within the facility. And if you have any challenges, you have stopped your periods, and you're having hot flashes, sweating, challenges with the menopause, you can also receive services from that facility. For the men, we are also screening them for prostate cancer. We do a random test so that we're able to offer you and link you basically to care. 7 beds. 7 beds.
Is that the appropriate capacity, or are those beds enough for you, or you still have space for others?
That's the capacity.
The capacity of the hospital.
The capacity of the facility now.
Honorable colleagues, we go to straight away on performance of GOU funds.
Sorry.
Yes, Honorable.
There was this issue of electricity, which is very, very sensitive. What other alternatives have you made, or what initiative?
Had a discussion, and they went back to sketch out a plan to see how do we tap from the closest direct line to ours, but it requires a cost. So that cost has not yet come back. That is one strategy as a facility we have done, and hoping they will be able to give us a feedback. The other is the use of solar. In the strategic plan, we think that we can harvest that electricity to support some of the running of the facility, so that we can reduce on the bill. It is still in the plan, and hopefully that should be able to help us alleviate it.
Okay, thank you, Doctor.
Thank you.